Masturbation is a natural and physiological behavior among many people, regardless of age or gender. It is often considered a part of healthy sexual development, helping people explore their bodies and satisfy their individual physiological needs. However, as people age, the body undergoes many biological and psychological changes that can affect how sexual activities, including masturbation, affect overall health. If you still masturbate, watch this video. It will answer your questions. In older adults, maintaining a healthy and balanced lifestyle is important to ensure quality of life. In this context, masturbation can become a controversial topic. Some argue that, although masturbation may continue to provide certain benefits such as stress reduction and improved sleep, it may also come with potential health risks that older adults need to consider. First of all, it is important to understand that older adults tend to become more sensitive to stimulation and change. The circulatory system, muscles, and internal organs can all decline in function over time. This means that activities that were once considered harmless or beneficial in youth may no longer be appropriate or safe as we age. Masturbation, if done excessively or improperly, can lead to a number of serious health problems. One of the first negative effects that can be mentioned is an increased risk of cardiovascular problems. When masturbating, the heart rate and blood pressure can increase, which can put a strain on the cardiovascular system, especially in people with a history of heart disease. In addition, excessive masturbation can lead to fatigue, physical weakness, and reduced recovery from other physical activities. Second, masturbation can affect the mental health of older adults. While it may provide temporary stress relief if it becomes a regular habit, it can lead to feelings of guilt, anxiety, and even depression. These negative emotions can reduce the quality of life and affect social relationships. Third, masturbation can cause skin and mucous membrane problems, especially when proper protection or lubrication is not used. The skin and mucous membranes of older adults are often thinner and more vulnerable, so excessive rubbing can lead to irritation, inflammation, and other skin problems. Fourth, excessive masturbation can affect sleep. Although many people believe that masturbation helps improve sleep, if done too often, it can disrupt the natural sleep cycle, leading to insomnia or poor sleep. Fifth, masturbation can affect overall sexual health. On older adults, maintaining a healthy sex life is important, but if masturbation becomes a habit that replaces sex with a partner, it can lead to a decrease in sexual desire and affect the emotional relationship. 6. Masturbation can reduce immunity. Some studies have shown that excessive masturbation can weaken the immune system, making the body more susceptible to infections and diseases. Finally, masturbation can affect the overall health of the body. When it becomes a regular habit, it can reduce energy, cause fatigue, and affect the ability to perform daily activities. In short, although masturbation is a natural behavior and can bring certain benefits, for older adults, considering reducing the frequency or stopping masturbation can be a wise decision to protect overall health. It is important to listen to your body, maintain a healthy lifestyle, and consult with medical professionals when necessary. 1. Decreased natural sexual desire. Frequent masturbation can decrease natural sexual desire with your partner, affecting your relationship and sex life. Changes in sexual desire. When masturbation becomes a regular habit, the body can become accustomed to self-satisfaction without sexual interaction with a partner. This can lead to a decrease in natural sexual desire, causing older adults to feel less interested in sex. This familiarity can reduce the stimulation and novelty that a relationship brings. Effects on relationships. Lower sexual desire can cause tension in relationship. Your partner may feel neglected or uncared for, leading to feelings of dissatisfaction and conflict in the relationship. A lack of sex can reduce the emotional connection between two people, affecting harmony and overall happiness. Psychology and emotions. When sexual desire decreases, older adults may feel anxious, guilty, or insecure about their sexual abilities. These negative emotions can add to relationship stress and affect mental health. A feeling unattractive or unworthy can lead to low self-esteem and a reduced quality of life. How to improve sexual desire. To improve sexual desire and maintain a healthy sex life, older adults can take steps such as reduce masturbation frequency. Consider reducing masturbation frequency to restore natural sexual desire with your partner. Increase communication. Openly discuss your sexual needs and desires with your partner to find a solution that works for you. Explore new sexual activities. Experimenting with different forms of intimacy can restore excitement and emotional connection. Focus on intimacy. Create intimate moments, not only through sex but also through activities such as hugging, kissing, and sharing emotions. Decreased natural sexual desire due to frequent masturbation can seriously affect the emotional relationship and sex life of older adults. It is important to be aware of these negative effects and seek solutions to improve sexual desire. But if this condition persists or causes stress in the relationship, older adults should consult a doctor or psychologist for appropriate advice and support. 2. Impaired cardiovascular health. When masturbating, heart rate and blood pressure can increase. For older adults, especially those with a history of cardiovascular disease, this can cause unnecessary stress on the heart. Increased heart rate and blood pressure. So when masturbating, the body goes through a series of physiological responses, including an increase in heart rate and blood pressure. For younger people, this usually does not cause serious problems. However, in older adults, especially those with pre-existing cardiovascular problems, this increase can cause unnecessary stress on the heart. Older adults are often at higher risk for cardiovascular diseases such as hypertension, atherosclerosis, and coronary artery disease. When heart rate and blood pressure increase during masturbation, this can increase the risk of cardiovascular complications such as angina or even myocardial infarction. In addition to physiological factors, masturbation can also cause psychological stress. Older adults may feel anxious or guilty about this behavior, especially if they have been advised to limit activities that may put stress on the heart. Psychological stress can add further stress to the cardiovascular system, leading to more serious health problems. For older adults, especially those with a history of cardiovascular disease, it is important to consult a doctor before continuing or changing your masturbation habits. A doctor can provide appropriate advice and help the patient better understand the potential risks. 3. Fatigue and weakness. Excessive masturbation can lead to fatigue and weakness, reducing the energy needed for daily activities and affecting quality of life. When masturbating, the body undergoes a complex physiological process, including an increase in heart rate, blood pressure, and hormones such as adrenaline and endorphins. These changes can create a feeling of excitement and satisfaction, but if done too often, the body will have to work harder to recover. This can lead to feelings of fatigue and weakness, low energy. And older adults often have lower energy levels than younger people, so excessive masturbation can reduce the energy needed for daily activities. They may feel exhausted, unable to participate in social activities, physical activities, or even daily tasks. This lack of energy can lead to feelings of depression and dissatisfaction with life. Impact on sleep. Masturbation can affect the sleep of older adults. Although some people find that masturbation helps them relax and fall asleep more easily, if done excessively, it can disrupt the natural sleep cycle. Lack of sleep or poor sleep can lead to daytime fatigue, decreased concentration, and decreased work performance. Psychological impact. Fatigue and weakness are not only physical problems, but can also affect mental health. Older adults may feel anxious, depressed, or guilty about their masturbation behavior. So these negative emotions can add to feelings of fatigue and weakness, creating a vicious cycle that is difficult to escape. Reduced quality of life. When fatigue and weakness become a regular part of life, older adults' quality of life can be severely affected. They may lose interest in activities they previously enjoyed, leading to social isolation and reduced interaction with family and friends. Although masturbation is a natural behavior, overdoing it can fatigue and weakness, especially in older adults. It is important to be aware of these negative effects and seek balance in life. If you feel tired or weak due to masturbation, older adults should consider reducing the frequency or consulting a doctor for appropriate advice to improve your overall health and quality of life. 4. Sleep disorders. Some people may have difficulty maintaining sleep after masturbation, leading to insomnia or poor sleep, affecting overall health. Sleep is an important factor in maintaining overall health, especially in older adults. However, some people may have difficulty maintaining sleep after masturbation, leading to insomnia or poor sleep. Here are some aspects related to this issue. When masturbating, the body undergoes a series of physiological reactions, including an increase in heart rate, blood pressure, and hormones such as adrenaline. These changes can create feelings of excitement and stimulation, but after reaching orgasm, the body needs time to return to normal. For some older adults, this process can take longer, leading to difficulty relaxing and falling asleep. Insomnia and restless sleep. When masturbation becomes a regular habit, it can disrupt the natural sleep cycle. Some people may find it difficult to stay asleep after masturbating, leading to insomnia or restless sleep. Insufficient or poor quality sleep can cause fatigue, decreased concentration, and mood problems. Sleep disorders are not just physical problems, but can also affect mental health. Older adults may feel anxious or guilty about their masturbation, which can add to stress and difficulty relaxing. This anxiety can make it more difficult to fall asleep, creating a vicious cycle of masturbation anxiety and sleep disorders. Sleep improvement solutions. To improve sleep, older adults can apply some measures such as establish a regular sleep routine, go to bed and wake up at the same time every day to adjust the biological clock. Create a comfortable sleeping environment, make sure the bedroom is quiet, dark, and cool. Relax before bed, do relaxing activities such as reading, meditating, or taking a warm bath to help the body and mind relax. Reduce the frequency of masturbation. If masturbation causes sleep disturbances, older adults should consider reducing the frequency or finding alternative activities to reduce stress. 5. Risk of infection from masturbation in the elderly. Masturbation is a natural physiological behavior, but if not done properly and without good hygiene, it can lead to many health problems, including the risk of urinary tract infections and skin problems. These risks can be more serious for older adults, especially due to weakened immune systems and underlying health problems. Here are some important aspects related to the risk of infection. Urinary tract infection. When masturbating, if hygiene is not maintained properly, bacteria can enter the urinary tract, leading to infection. This is especially dangerous for older adults, as they may already have health problems such as diabetes or other conditions that increase the risk of infection. Symptoms of a urinary tract infection may include pain or burning when urinating, feeling the need to urinate frequently, urine that smells bad or has an unusual color, pain in the lower abdomen or back, skin problems. Masturbation can cause skin problems if not done properly. The skin in the genital area is often sensitive and easily damaged. Without proper protection or lubrication, excessive friction can lead to skin irritation, contact dermatitis, bacterial or fungal infections, effects of AIDS. So many people may use aids during masturbation, such as sex toys. If these objects are not properly cleaned before and after use, they can become a source of bacterial contamination, leading to the risk of infection. In particular, sharing sex toys without cleaning them can increase the risk of contracting infectious diseases. How to reduce the risk of infection. To reduce the risk of infection during masturbation, older adults can take the following measures. Keep clean. Wash your hands and genital area with soap and clean water before and after masturbation. Use lubricants. Use safe lubricants to reduce friction and skin damage. Clean sex toys. If you've used sex toys, make sure to clean them properly before and after use. Monitor symptoms. If you have any symptoms related to infection, consult a doctor immediately for timely diagnosis and treatment. The risk of infection due to masturbation is a serious problem that older adults need to pay attention to. Maintaining good hygiene and taking precautions can help minimize this risk. If you have any symptoms related to infection, older adults should seek advice from a doctor to ensure their health and quality of life. Maintaining personal hygiene and health care is important to protect overall health in old age. In summary, although masturbation is a natural behavior, older adults should carefully consider how often and how they do it to ensure their physical and mental health. So maintaining a healthy lifestyle, including a balanced diet, regular exercise, and maintaining positive social relationships can help improve quality of life in old age.